Good afternoon, everyone. Welcome to SADS Foundation Live number 105. It's great to get to be with you again. I'm Mike Ackerman, genetic cardiologist at the Mayo Clinic and director of Mayo Clinic's Winland Smith Rice Genetic Heart Rhythm Clinic and the Winland Smith Rice Sudden Death Genomics Laboratory. As in the previous 104 SADS Live programs, I greet you from Alice Laura, the CEO of the SADS Foundation, the Sudden Arrhythmia Death Syndrome Foundation. We are so excited to be together again. I can't wait to see who's coming in live and who will be joining us later on any of the social media platforms where it's displayed. So whether you're here in the US or it's in the evening in Europe or wherever you are, maybe joining us for breakfast down under, I'm so glad you're taking this time out to be with us. It is great to be alive. There's a lot of chaos out there, but as we are now the Friday before Thanksgiving, it's always good to pause and reflect and see how long you could take to display an attitude of gratitude and list out what all you're grateful for. Just think about that, contemplate that. I can take a long time to list out all that I'm thankful for. And I think it's healthy to do that exercise. I do it from time to time, as often as I can. And we have so much to be thankful for in this crazy, chaotic thing called our world. And I, for one, am very thankful for you, our SADS families, here, there, everywhere. You are why we exist at the SADS Foundation. You're our whole purpose of existence is to be there for you, to meet your needs when you need them to be meted, to be your voice as we try to advocate for various things with respect to your SADS related condition. So whether you're here with long QT syndrome as what brings you here, or Brugada syndrome, or ARVC, or CPVT, or Timothy syndrome, or whatever your entity is, we hope that you have found this to be your home this past year. Things that we can do better, let us know. We're not satisfied with status quo. We want to continue to get better. I'm thankful to have you in my life on these Fridays. Many of you are my own personal patient, and it is an honor and a privilege to be counted as your doctor. For those of you who I've never met you yet, but we feel a connectedness through this vehicle, it's a treat to get to be a part of your life in that way and for you to have a part in mine. So thank you for your lives. I know that as we come upon Thanksgiving, knowing full well what SADS is all about, that there may be an empty seat at your table. And if that's a recent seat of a tragic departure taken far too soon and unacceptably so, we grieve with you. And I know Thanksgiving may not be a time at that moment of gratitude, but one of a tragic, profound sadness and grief. So we do think of that. We're mindful of that for you and your families, whether that tragedy occurred in the last 6 to 12 months, calendar year 2022, or whether it was 20 years ago. And you think about that sudden death of an aunt, an uncle, a cousin, whatever it was, it's still very real and present. So I'm mindful of that for our families. We know that for most of our SADS conditions, that now in 2022, when we diagnose it, when we carefully assess the risk and predict the future forecast, we dial in a use specific and a genetic specific and a tailored treatment program, that those tragedies almost never happen anymore. And I'm thankful for that, for the progress that we've made in our field as genetic cardiologists, taking care of families with these sudden death predisposing genetic heart diseases. Yes, they are sudden death predisposing. There is a non-zero risk, but the good news that I'm exceedingly grateful for is that that tragedy almost never happens anymore. And so that's the reason why at the SADS Foundation, we discuss that our intention is to help empower and enable you to live and thrive despite your diagnosis. And so thank you for who you are. I'm just stimulated many times over by your courage, by your desire, by your dissatisfaction with the status quo, that we have much more to do yet. And even though death does not happen, we still need to figure out ways to prevent the first death. When and how do we start to screen for these conditions? We still need to come up with better therapies, even though death has been largely thwarted. I know full well that we're not necessarily living as large as we can be, because for some of us, the treatment strategies have brought with it its own issues called, thank you very much, I'm that beta blocker zombie now. Yes, most people tolerate beta blockers beautifully, but those that don't, I tend to find you, see you, or you find me, and we try to come up with an alternative program so that you feel better on a daily basis, when for you, that medicine's not agreeing with you. So I'm thankful for those entities out there that are helping to develop new treatments. And I've never seen as much activity in our field of new therapies that are in the R&D pipeline in the last 1-2 years compared to the first 20 years of my career. I'm thankful for that. So we have so much to be thankful for. And of course, how do I not be thankful for this? My family. I'm blessed with a beautiful wife, the same one, almost 34 years now. I'm blessed with 4 children. We just finished the This Is Us. If you want to be thankful and feel thankful, wow, that series, I've never shed more tears over TV in my life than This Is Us. And my wife and I watched the final episode last week. So they have the big 3. I have the Fab 4, my 4 children, and I'm thankful for each of their lives. My 2 granddaughters, our 2 granddaughters, Jaden and Juniper. Juniper born August 31st, the newest addition to the Ackerman family. Beyond grateful for their lives. I love my work, Mayo Clinic. I love my employer. I love this institution. It is a privilege to care for families here, there, everywhere at this place called Mayo Clinic. I have so much to be grateful for, and I'm sure if you took the time, you would be able to think for 5 minutes, 10 minutes, 30 minutes, and a continuous stream of those who you're thankful for. I have dear friends throughout the world that those group, incredible men and women who it's a privilege to be counted as their colleague and their friend. And now I'm going to pause and I'm going to look over here and not look for your questions, although if they're there, I'll grab them, but look for your expression of gratitude and I'll share it with everybody. And we'll just enjoy a moment of not seeking to receive necessarily new knowledge, but to give thanks. And that's what this beautiful season of Thanksgiving is all about. And so let me see what's come on in. From the SADS Foundation itself, we're so grateful for all of you in our SADS community. Thanks for joining us for another great year of SADS Live. And they're asking you to let us know what you're grateful for. So I'm really thankful for our SADS Foundation, our team, Alice Laura, an incredible CEO, Marcia, our Director of Education, Jan, our Director of Development. If you're thankful, go to www.sads.org, top right corner, donate online now, and give that gesture of thanksgiving. I'm thankful for Anna and Aaron, who brought us into this new world of social media. They're incredible young women, and I'm thankful for them and their lives. Genevieve and all that she's doing to connect families together. We have a great team at the SADS Foundation, and I'm thankful for them. Julie is sharing with us. Hi, Julie. Grateful to be here. Grateful to us, Dr. A. I guess that's me. I like that. And SADS Foundation for the info. We try to provide really good information at SADS. You go to the website, to the materials. Hopefully you find what you need. You get your questions answered there. You see what's going on in real time. You get connected. And so I hope we have provided great information, and I'm thankful for those who do that. And we see this thing all live stream. Wow, that's neat. That's new. So these social media platforms are incredible. Now, some of them come with incredible baggage, but they can be used for good. And when they are used for good, I'm certainly grateful for that and the opportunity to reach people all over the globe who we never would be able to reach in the old way of doing things. So Aaron, again, Anna, give you 2 shout outs for what you've enabled us to do now at the SADS Foundation. Jill, hi Jill, that's my sister's first name. And Jill is grateful to Officer Richard Salgado, a stranger passing by who stopped and administered CPR to our son until the first responders arrived at the scene. And so that is, and thank you, Officer Salgado, for your service. Those men and women in our law enforcement, police officers, fire department, first responders, boy, we should be thankful for you. I am. And you matter a lot. We would not have society without you. And so you saved Jill's son. And we are part of trying to create an army of first responders who knows CPR, who could use an AED. And so that when there is a near tragedy, we can thwart that tragedy because of effective CPR. Yeah, I'm thankful, Jenna, for people like Dr. Cron. So Andrew Cron was our 3rd Windland Smith Rice visiting professor here at Mayo Clinic. First was Arthur Wilda, 2nd Chris Simsarian, 3rd Andrew, Dr. Cron. And we were hoping to have Dr. Sylvia Priori as our 4th, but her schedule didn't permit it. We're going to get her. But for colleagues like them who are committed to these conditions, everywhere. And so, yes, Jenna, you're in good hands with my good friend, Dr. Andrew Cron. Thankful for him and his life and what he's done. He's been our president of Heart Rhythm Society. And Summer's grateful for her husband who gave me CPR after her cardiac arrest, and then finding people who understand long QT syndrome. I'm grateful for that too. And I'm thankful that your husband did good. And just like we had Lady Gluckenflecken with us on live when she delivered CPR to her husband and saved his life. And so indeed thankful. I'm sure for those of you who are sudden cardiac arrest survivors because somebody did rapid and effective CPR and somebody called 911 and activated the chain of survival. And then somebody arrived, the first responders, to use that automatic external defibrillator and deliver you your life-saving rescue shock. Wow. Lots to be thankful for in that incredible chain reaction. Of course, I'm mindful that there are those where, as hard as we might have tried with the chain reaction, it was too little too late, and we were not able to rescue that life. And instead, for you, there's that empty seat next Thursday for those of us celebrating Thanksgiving in the United States. But certainly, Summer, well done to your husband. Way to go. Sophie sharing that I'm grateful for the SADS Foundation and all the other institutions worldwide who are doing research in different rare congenital heart conditions. And I'm thankful for those investigators throughout the world as well. We've had many of them on during the previous 104 SADS episodes, and we'll have more in the coming year where we'll interview them. Hopefully, we will start to have those companies and the leadership from those companies that have developed and are developing new therapies for which there will be new clinical trials in motion in 2023 for long QT syndrome. I'm aware. CPVT, I'm aware, two of them for CPVT. First in human gene therapy getting set in motion for myosin binding protein C mediated hypertrophic cardiomyopathy. Incredible activity. We'll get them on. And then we have those investigators with their own research programs here, there, everywhere, and we'll have some of them throughout 2023. And so appreciative of those physicians and those scientists and those physician scientists who are trying to heal the sick and advance the science. And if you don't know, that's probably one of my most favorite Mayo Clinic quotes from one of our founding Mayo Clinic brothers, that the whole purpose of what we do in medicine and biomedical science is to heal the sick and advance the science. So thankful for all those individuals. Lauren sharing that she's grateful for SADS and for Genevieve. Felt confused and lost before finding this foundation. And so I did mention Genevieve. She's one of our newest members of the staff at the SADS Foundation. And boy, does she do an amazing job at those critical touch points when you are very fragile, and pointing you in a direction and making you feel and know that if you have one of these conditions, that the SADS Foundation is your home. Hey, Sherry. Sherry's been with us a lot. I love it when I see her name show up on the sidebar, and being thankful for our research and the collective research. Thankful for all that responded, friends, EMTs, all the doctors and nurses, the rehab staff, and the Navy that all saved her son. I love those saves. It took a lot just from all that she shared to make that save happen. And this is one of the reasons why, of course, I'm thankful for that chain of survival, but boy, I look forward to saying how thankful I am that we all have figured out how to screen for these conditions. Should we be screening for long QT syndrome? Affects 1 in 2,000 people, maybe 1 in 1,000 individuals. Highly treatable. We're good at it when we find it. Yes, it's time for universal screening for long QT syndrome. We just need to figure out the how, because the current how, a 12-lead electrocardiogram, may not be the solution. In fact, it won't be the tomorrow's solution. And so screening, and when we find that, so maybe we would have found what your son had before that chain reaction ever was necessary, and we could have intercepted it, dialed in the appropriate therapy, and such that that whole thing would not have been necessary in the first place. Won't that be an incredible expression of gratitude when we have achieved that? Oh, I can't wait. We're trying. Andrew, grateful for the Mayo Clinic. Oh, thanks. And to the office of Dr. Ackerman and Dr. John Giudice, who will hopefully soon be reviewing your Brugada case. I'm thankful for you. And I said at the beginning, one of my short lists of things to be grateful for is that as a 22-year-old, I found Mayo Clinic, or Mayo Clinic allowed me into her family as a medical student and a graduate student for the Mayo Clinic Alex School of Medicine's MD PhD program. And I came here from Iowa, summer of '88 at age 22, and I never left. You're right, it's only 5 years later, but I've never left. And so, no, it's been here the subsequent 30 years now. Whoa, 34 years now since arriving here to this place called Mayo Clinic. And I'm so thankful to have the privilege to work here. And you mentioned My partner, Dr. John Giudice, thankful to have a partner, not one, but now two in our Winland Smith Rice Genetic Heart Rhythm Clinic. I was solo for 20 years, but a year and a half ago, John Giudice became our second genetic cardiologist. And 8 months ago, February of 2022, Dr. Kirsty McIntyre became our third genetic cardiologist. Man, I'm thankful for both John and Kirsty. Uh, they have been a beautiful addition to our program. Jenna's grateful for beta blockers. I love it. And other life-saving drugs. Thanks, Jenna. Yeah, beta blockers sometimes gets the bad rap, doesn't it? And I shared in Houston for our SADS Foundation conference last weekend, and wow, that was a great one. Thankful for that and all the hard work from the SADS Foundation team to put on that. But we talked with those families there how there's gets this impression and probably amplified in the echo chamber of social media and support groups in terms of the voice of those who hate life on beta blockers, the self-declared beta blocker zombie. Those voices get loud, appropriately so. They're frustrated. And all of those who are doing great on their beta blocker therapy and are thriving may not be having or taking as much time to express their satisfaction to counterbalance. So I too am grateful for beta blockers. I love them and they work really well until they don't in terms of disagreeing with that person. And then we have other drugs. And I'm quite excited, Jen, and grateful for the fact that we have new drugs in the queue for the first time, and we have the potential to start a clinical trial next year for what would, if it works, be a first in human new drug, FDA approved for the specific indication of long QT syndrome. Oh, won't that be great? We can only hope. Time will tell. We'll see what the scientific truth is, but it's in motion. And I'm thankful for that. And the company Thrive Therapeutics that will be developing and pursuing that new drug. There's two new drugs in motion for CPVT. Thankful for those companies, Cardurian Pharmaceuticals and Armgo Pharma, as they start to initiate a new clinical trials for those potential new therapies for CPVT. Oh, we have so much to be thankful for, don't we? Sophie is thankful for the past talk on supplements and wants another one. And we'll do that. We'll make sure in 2023 that we'll give you something to be thankful for besides what we talked about and add round 2 of supplements. And you're very welcome, Britain, and your daughter. I'll trust that things are going to go very well. And Andrew's expressing a gratitude to the SADS team, Genevieve, Alice, SADS community for this time, their stories, and the social media team that's putting all of this out and helping him not feel so alone, and families and individuals like that. And yes, Sophie, the 1 in 2,000 people is congenital long QT syndrome. And I'm not discussing those who might have vulnerability to drug-induced QT reaction. And I'm getting the pronunciation of Putrea. So hi, Putrea. Thank you for that. And let's see. And Hannah, I'm thankful for your email that I'll get to take a look at and look forward to seeing that. We have gratitude and Thanksgiving from Lene and her family. So Lene, don't tell anybody out there, one of my favorites, but we've known each other for a long, long time, haven't we? And I'm grateful for you and your daughters, your family, and all that you do, your support of the SADS Foundation. Thank you for your past gifts to us. And I'm indeed thankful for you. And as you know, I love my framed picture of your beautiful daughter. So thank you for that. Oh, thanks, Julie. Grateful for faith, science, and facts over fear. And as you know, I'll show you. One of you gave me that shirt, which stays there. It won't leave. Faith over fear, and I love that shirt and what it's all about and all that it represents. So, thank you for that reminder, Julie. Let's see as we come down and they continue to come in. We have gone pretty much what 20, 15, 10, 25 straight minutes of doing nothing but saying thank you. Isn't that powerful? I love it. I do that in the morning. I do that in my walk to work in the morning and at night, just giving thanks. We spend so much time, we, the proverbial community of humans, complaining of this, that, the other. There's plenty to complain about. But man, is it refreshing and fulfilling to just shift the gear to one of thanksgiving. Does the body good? Does the soul good? So thank you for letting us use this program to do less of your questions and more to just say thank you. And Hannah, you're welcome. Oh, I see now, Petrea. Her comment or the comment didn't show up before. Expressing gratitude for the EP at Hopkins, Dr. Andreas Barth, and the strategy there that helps by doing the pacing for the beta blocker. Great colleagues, Dr. Barth and Johns Hopkins, one of the leading programs for ARVC. We have so many special programs out there and individuals that lead there and take care of, and they are here in the United States. And then, of course, throughout the world, we already mentioned the good hands of Dr. Andrew Cron in Canada, Arthur Wilda in Amsterdam, Sylvia Priori in Italy, Peter Schwartz, who I've interviewed, Chris Samsarian in Sydney, Australia, and the list can go on and on for quite a long time. And I'm thankful for those individuals. And let's see, Britain with her 15-year-old daughter, Aniston, diagnosed at age 9 with CPVT, treated with Nadolol. I like that beta blocker. Flecainide, I like that medicine. Got a defibrillator a couple of years ago. Had a sudden cardiac arrest a little of a month ago, and then denervation in Houston last week. And so wish you best with that result. As you know, we have provided and done more left cardiac sympathetic denervations here at Mayo Clinic than anywhere in the world. And I'm so grateful for my surgeon, Dr. Chris Moyer, who developed this, advanced it to do it minimally invasively, has done more than anyone. But then what I love about Dr. Chris Moyer is a lot of surgeons, when they retire, sometimes they're comfortable with having that boutique operation that they're the best at in the world sort of end with them, not Dr. Christopher Moyer. He, over the last 5 years, mentoring, training in Dr. Stephanie Polides so that we would not have any break in action or any break in the excellence achieved here with this program, with the handoff, the beautifully successful handoff to Dr. Stephanie Polides. She's an amazing surgeon. And so I'm thankful to have a partner like Dr. Christopher Moyer, and now having the right to enjoy retirement and having the confidence and the satisfaction that that treatment offering continues beyond his time frame of doing it. Thanks, Chris. And Britain's mentioning Dr. Jeffrey Kim. Dr. Kim and his team, Dr. Christina Miakis, they finally, after a 3-year delay, we did SADS Foundation live, the real live, as in person, last Friday and Saturday. The CME program among the healthcare providers on Friday was phenomenal. You won't find a better one, a one-day program. Nothing done at Heart Rhythm Society and the other official cardiac societies matched the program that Dr. Kim and team put together. And then Saturday, we had a fabulous program with the families there. So I appreciate Jeff, Dr. Kim. I appreciate Christine and Dr. Miakas, their way, their lives. So thanks. A shout out to you. And yes, Sherry's wondering about denervation and LQT3. The beauty we have now is in long QT syndrome, I'm thankful that we get to think about these diseases beyond just, I have long QT syndrome. And we are to the point where we have been for quite a while now and continue to do what we call genotype directed tailoring of therapy in long QT syndrome. We think about long QT1 differently than LQT2 and LQT3. Our treatment strategies are different. The response to therapies are different. So yes, we know that denervation surgery works absolutely the best in LQT1, probably next best in CPVT. And there is some data of efficacy in long QT3, but in our own program, maybe it's because we tend to get very aggressive, bad long QT3 sent for surgery, that we're not seeing an impressive treatment response from the denervation in that group. And so I'm not as enthusiastic about denervation for LQT3. We've tried it when we are thinking of what are our final treatment strategies and options. But overall, my mood about denervation for LQT3 is certainly less optimistic than it is for LQT1 and LQT2. But I'm grateful that we can even think like that. We weren't thinking like this just a handful of years ago, of tailoring therapy to you, the person, to your genetic driver, to your situation, to your quality of life desires. And so we've come so far from a one size fits all. Sorry, Charlie, too bad you feel lousy on your beta blocker. We're stuck. Or you're going to get a defibrillator. Don't ask another question. Or sorry, you're disqualified from all competitive sport. Just sit on the couch. That's so yesterday. That's so 20 years ago. And I'm thankful that we have the new way of how we take care of you all and how we think of your conditions. And then we have one coming in on the bottom, and I'm reaching the bottom of your list of Thanksgiving and or questions, and approaching the top of the hour. From Krishnan, in cases of hypertrophic cardiomyopathy with prolonged QT on the ECGs, will the T wave and the QT interval behave as they do in long QTC during stress tests? QT hysteresis, as in LQT2, for example. Wow, that's a big word to wrap up our program. I'm not going to really unpack what QT hysteresis means, but I'll make a couple comments there. One, I'm thankful at the SADS Foundation that we get to partner with Lisa Salzberg, the CEO of HCMA, Hypertrophic Cardiomyopathy Association, that is there for those families with HCM. And when the portal of entry is sudden cardiac arrest, and they might call us at the SADS Foundation, and we discover that the root cause is HCM, they get routed pronto to Lisa and her organization, HCMA. And she does the same thing when it's discovered that that patient's diagnosis is one of the SADS conditions of long QT and CPVT and so forth. So to have these relationships among these advocacy organizations where we've partnered together because we have the same goal: meet your needs, support you, find answers, make sure you're getting cared for by competent expertise. Specifically with the question, we and others showed many years ago now that about 10% is the sum of patients with HCM also show a prolonged QT interval that recently has emerged as a newer additional risk factor in HCM. Those with HCM and a longer QT interval, they might be more twitchy for an HCM triggered arrhythmia than those who have a normal QT interval. But their reaction on the treadmill stress test, for what it's worth, does not happen to look like the LQT1 pattern or the LQT2 pattern. It essentially normalizes during stress testing. And Andrew, we'll just leave your question for now. I'm not going to blow it off, but just in the interest of time, knowing that we've come so far that we can have community to ask such impressive questions, and you'll get those answers. And Emily's final question of the day. She needs to have oral surgery. She's 44 years young with asymptomatic Brugada. Is midazolam a sedation medication and fentanyl safe for light IV? Yes, most of our low risk Brugada patients, and by your description, you probably are, we can do those elective procedures. The biggest thing is that to make sure that the healthcare team is aware and they can say, yeah, so noted, and we would have a plan for a worst case scenario during that procedure. And if we are forewarned and forearmed, that scenario basically almost never, ever happens. Well, here we are wrapping up November 18th, 2022 and SADS Foundation Live 105. I hope you've enjoyed to pause and reflect on all that we have to be thankful for in this time of our lives, with this time that we have with our precious families, in the communities that we live, in the country that we reside in, amongst all of the chaos and disruption and corruption that is all abound. Yet we should still pause and reflect, because we have much to be thankful for. For those of you in the United States, where in 6 days, happy Thanksgiving. Thank you for taking the time. I wish you a blessed Thanksgiving wherever you may be. And it is truly a blessing to get to be with you today and on the every other Fridays to come. I wish you all the best. Blessings to all of you. Happy Thanksgiving.